Well, new research and a trend we've seen growing over the years, kids stuck on their screens. An article for The Atlantic features a New York University professor writing that the smartphone, not the pandemic, has been the key driver in the teen mental health crisis. They point to data that shows rates of depression and anxiety in young people rose by more than 50% in studies from 2010 to 2019. That's before the pandemic. It's when teen smartphone and social media usage, though, spiked. A new study by the American Academy of Pediatrics, meanwhile, finds a 64% increase in antidepressants being prescribed to young people since just 2020, and it's even higher for young women particularly. So I wanted to know more about this. I sat down with Carrie Peterson, the director of the Psychiatric Nurse Practitioner Program at the CU College of Nursing. Why would a teenager be concerned then if a popular antidepressant was offered to them or prescribed for them?
So antidepressants are a very effective treatment for managing depression and anxiety. And so really there's been a lot of research that has shown they are effective in children, but they're not without side effect. There's the potential to increase suicidal thoughts with adolescents, children and adolescents who are taking antidepressants, especially in that initial phase, the first month or two after they begin taking it.
Most antidepressants can take 6 to 8 weeks to work even, so it's very important to monitor the early stages. But Peterson says most importantly to remember is that medication doesn't necessarily solve the problem. What should be included in that holistic approach?
So I assess my patients to really see what's going on across multiple domains in their life, and looking at social and their relationships and all these different pieces of what's happening. But I think in terms of other treatment options that we could look at, of course, there's talk therapy, psychotherapy that has shown to be effective as well with helping. And then looking at things like their diet, their exercise, are they sleeping enough?
Unfortunately, there is a shortage of mental health professionals, especially for youth. Peterson says studies show only 20% of young adults and adolescents who need treatment are actually getting it. But in Colorado, students in kindergarten through 12th grade can get 6 free virtual counseling sessions through the I Matter program. It's a temporary program started after the pandemic, but a bill going through the state legislature right now would make that permanent. Also, we want to remind you, if you or anyone you know needs help, Colorado Crisis Services has free, confidential support from trained professionals available 24/7. The numbers here are on your screen.